And migraines, they affect nearly 40% of people globally. But did you know women are 2 to 3 times more likely to suffer from them than men? From puberty to menopause, hormonal shifts heighten pain sensitivity in the brain, yet women's headaches are often misunderstood, minimized, or mistreated. Dr. Ella Akkerman of VSI here to share some insights about the issue, what we can do about it. Glad to have you here with us, Dr. Akkerman.
Thank you for having me, Jacqueline.
So talk to us a little bit about the difference between, a harmless headache, albeit it might be painful, versus a migraine, and the difference between those two and some of the red flags to keep an eye out for.
Absolutely. The main thing is disability. What does it do to you? Does it stop you in your tracks? Do you have to lay down, sit down in a dark, quiet room, not move, stop doing what you're doing? That is not a regular average headache. And so if you are feeling sensitive to light, to noise, or nauseated, and the headache is lasting for hours, that is a migraine, at least if everything else is ruled out.
Okay. What are some of the triggers that you see when it comes to migraines? Because I've seen a lot of things that maybe are myths versus facts. So break that down for us.
Stress is a common trigger for
Okay.
everyone, men and women.
Yeah.
Sleep. And then hormones for men and women, but for women more than men, because we obviously are creatures of offspring. We are meant to produce offspring. Our hormones are 3-4 times more robust than men's, and the fluctuations in those hormones really affect us.
Interesting. Admittedly, I used to suffer from migraine several years ago. They've since subsided, but I used to have to track my triggers. And when I say I would sit there and write everything from the weather, I don't know how much that was a fact, but what would you recommend for folks that maybe think that they have migraine? Should they be tracking some of those triggers just to keep all of that into an entry?
Absolutely. Migraine diaries is something that's recommended for all migraineurs. Basically, circle on the calendar, when do you have a migraine, how bad it is, and what has helped it. What did you do that made a difference for you? For women especially, it's very important because of our menstrual cycle. And so we are more likely to have migraines right before, during, and right after the menstrual cycle. And at least that reassurance when you see when your migraine occurred will make us not feel so anxious about what's going on with our bodies.
Interesting. So it seems women are more susceptible to getting some of these migraines. Okay.
Correct.
What's happening exactly in the brain as these migraines are happening?
Well,
we got a
funny
brain.
that you ask, Jacqueline. I brought my little brain, my pink brain. So in the past, researchers thought that migraines originated outside in, meaning in the blood vessel dilation, which triggered the pain. However, now we know the signals start deep inside the brain in a structure called hypothalamus, and that is our hormonal factory. And that's why our migraines are so cyclical, because hypothalamus also controls our circadian rhythms.
Interesting. Okay.
Yes, so that's where the pain signals are generated, and they travel outside into the coverings of our brain and our blood vessels, and there are many painful chemicals that are released, including a chemical called CGRP. And that particular chemical has drawn a lot of attention recently, and there are a lot of effective medications that have been produced to target this chemical, these medications are very effective in controlling migraines.
That's what I wanted to get into lastly, if we can, talking a little bit about how to treat migraines. I know there's a wide spectrum that range all the way from more serious treatments when it comes to like Botox and things of that nature versus some more lesser treatments. So can you tell us what are some of the recommendations out there?
Absolutely. If your migraines are difficult to treat, they occur at least once a week, or they are debilitating, all of those reasons will make a physician prescribe a preventative medication for migraines. This is a medication you're supposed to take on daily basis, or the medication that is in your system on daily basis that is decreasing intensity and frequency of migraines. And then the second class of medications is abortive migraine treatment. And abortive migraine treatments are those that you take at the earliest onset of a migraine to decrease release of these bad chemicals that cause pain. And the sooner you treat the migraine when it starts, the more effective you will be at aborting it, stopping it in its tracks.
That's what my doctor, I think, used to call the rescue medication.
Correct, correct.
Dr. Akkerman, where can more people find information if they have any questions about migraines out there?
Find me in VSI. It's in Reston, Virginia, spinemd.com.
Fantastic. Very helpful. Thank you so much.